the cumulative probability of remaining free of diabetes as the study progressed. And you can see that at 3 years and 4 years, in the top slide, there was this significant reduction in likelihood of developing type 2 diabetes, and that reduction was 58%. I've mentioned the Diabetes Prevention Program. This was an NIH-supported study in 27 American centers, started in the mid-1990s. When this slide was made, it was the largest diabetes prevention trial yet to be published. You see the numbers there. And the excuse me, the randomization was either placebo, metformin, troglitazone. How many of you have heard of troglitazone or remember troglitazone? Hands up. Not too many. Troglitazone was the first glitazone introduced in the 1990s. Actually, it was, in my opinion, a pretty effective drug. And I dare say, I think it had, most patients seemed to like it at least as well as they liked Avandia or Actos, that's rosiglitazone or pioglitazone. But it was, unfortunately, had one major defect, and that is that about 1 in 50 patients developed an idiosyncratic hepatitis with troglitazone. And if you weren't careful and didn't monitor the liver function tests, then patients could get into severe difficulties, including death or the need for liver transplant. And therefore, around, I think it was 1998, that the FDA recommended that troglitazone should be removed from the US market. And this was just at the time when rosiglitazone and then a number of months later, pioglitazone came on board and were approved. But anyway, troglitazone was included in this diabetes prevention program, and I'll show you the results later. And as this slide says, it was discontinued. That arm of the DPP was discontinued because one patient in the study developed liver failure. And if memory serves me right, and I don't think this is just scurrilous rumor, I think the patient was actually the wife of a lawyer, which weighed heavily on the people who were controlling the diabetes prevention program. So the troglitazone arm was discontinued. Here are the results: placebo versus metformin versus lifestyle change. And this is the cumulative incidence of diabetes. So this is the this is an upside down version. Not sure who that is. Oh, that's my time up? Oh, well, I won't have too much. I will not take too much longer. So you will see that metformin decreased the accumulation of diabetes by about 58% in comparison to placebo. Lifestyle was 58%. Metformin was just about 35%. So metformin works in terms of preventing type 2 diabetes, but it is not as effective in a clinical trial as lifestyle change. And this, I think, is a very important thing. As I say to my patients, real life is not a clinical trial. We don't have the means to put in the same effort and the same week-to-week attention to patients in real practice as happens in well-funded clinical trials. So I think it's worth remembering that metformin can actually decrease the progression from impaired glucose tolerance to type 2 diabetes. Or you could ask, is it just masking the diagnosis? Because once you put someone on metformin, of course, the metformin has the capacity to treat the high glucose if they should develop diabetes, and therefore you might just be masking the diagnosis. Here is the result with troglitazone added. So above it, you see the effect of lifestyle and metformin, and you'll see that troglitazone was even more effective than the lifestyle. And as I say, this particular class of drugs seems to have been, it has a good track record in this type of study. You'll see that when you look at the effects on other cardiovascular risks, however, in DPP, that lifestyle was rather better than metformin or placebo on reducing blood pressure and triglycerides, and just pip them in terms of increasing HDL cholesterol. There's no doubt that if you do exercise fairly regularly and lose weight, then you can increase your HDL cholesterol a little bit. Stop NIDM was a trial of acarbose, which is an alpha-glucosidase inhibitor, and you can see that excuse me, this actually did show an effect, and in this study there was also an effect of the acarbose on decreasing cardiovascular events, something which is quite often forgotten, but my own experience is that acarbose is or proves to be a rather difficult drug for many patients to tolerate because of the unacceptable gastrointestinal side effects, particularly excess flatus. I just want to mention troglitazone in the prevention of diabetes because, again, this tripod study I think was a useful one and a very interesting one. And this actually looked at non-pregnant, non-diabetic Hispanic women in California who had had a recent pregnancy in which they developed gestational diabetes. And this was a very high-risk group. They were selected on the basis of their glucose tolerance test, giving a 70% 5-year diabetes risk. And they were treated with either placebo or troglitazone. They had fasting glucose every 3 months, oral glucose tolerance every year, and intravenous glucose tolerance at 0 and 3 months. And they were looking at diabetes incidence rates and beta cell function. And basically, here's what happened. So this is the number of patients, the percentage of patients who during this study were diagnosed with diabetes, and you see that in this high-risk group, just over 12% of the women per year became diabetic. And you can see that the troglitazone-treated group had a much less likelihood of being diagnosed diabetic. Now, what I said earlier about metformin could mask the diagnosis, exactly the same thing would be true of troglitazone. So you're treating the woman, you're measuring the glucose. How do you know that she hasn't actually become diabetic, but the troglitazone is just preventing the hyperglycemia, not really preventing the diabetes, if you know what I mean? So what they did in this was the reduction. This study was stopped, actually, because of the problems with troglitazone. But in the follow-up, 83 of the 101 women who completed tripod without diabetes were followed up. 39 were from the placebo group and 44 from the troglitazone group. And they had tests then 8 months after the study stopped and after they had stopped taking either a placebo pill or the troglitazone. Now, there is the initial result as I showed.